normally present this seminar to a group here in our office, but tonight we just have some of my staff, Tammy and Jennifer and my wife, are sitting here. So I want to thank you guys for helping set up and technologically helping us with everything. So we're going to talk about bioidentical hormones tonight, not only about bioidentical hormones, but how can these hormones help us as we age? How can they help us age gracefully, live longer, not only longer, but healthier as we go? I wanted to start by talking about my story, because my story is a prime example of how you can use balancing or hormone balancing and to help you with your aging process. I started off as a general practitioner, had an ER in Tarpon Springs, Florida, and I was an ER doctor, young Doc Watts, I guess, at that time. And I went through a residency in 1980, finished in 1980, came to Sarasota, Florida, and started practicing, delivered lots of babies, started doing a lot of hormone balancing. Back then we were using more synthetic hormones. But at that time, maybe 20, 25 years ago, I started watching some problems over in mostly Europe, and they were finding that these synthetic hormones cause a lot of cancer and heart disease, things such as that. So we started looking into natural hormone balancing. About 20 years, I started into natural balancing. Well, coming up as the time I was about in my mid-50s, I started having problems. I looked in the mirror. The first thing I noticed was I was losing hair. I was getting fat. I went to my doctor. He said that things were pretty bad. He said I was getting high cholesterol, high blood pressure. It said if I didn't change, I was going to have diabetes. I can tell you, I went home to my wife. She even gave me worse news. She said I was turning into a curmudgeon. And when I finally looked that word up and found out what it meant, I was appalled, So I knew I needed to do some changes. She said, well, why don't you run some hormone levels on yourself? Why don't you look to see what your levels are? And I did, and of course they were very low. I went on natural bioidentical hormones like I'm going to be talking about tonight. And that was over 15 years ago. I'm now 73 years old. I feel better now with more energy, more pep, brains, sexuality than I did at that time. So that's an example of myself. We're going to be talking about men versus women tonight, so we'll take a look at that. We're going to look at part one. This is going to be delivered in two parts. Part one will be the male and female hormones, gonadal hormones they're called. What are bioidentical hormones? How do hormones help us in age management? What about testing? And then part two will be delivered on our web page. Is that right, Jennifer? We call a web page, so you can dial in on the renewalpoint.com and pick that up. We'll be doing that in 1 month, and so we'll be talking about the adrenal and thyroid axis. The Renewal Point is we base our therapies mostly on 4 cornerstones, so just 4 simple things. One is hormone balancing, fitness, nutrition, and detoxification. Of course, we're talking about hormone balancing tonight. But fitness, that's how you have your body composition, now your strength and your joints and your how you feel with movement, how your heart works. Nutrition, so make sure that you have no nutritional deficiencies, how you eat, what your diet is. And detoxification, make sure you're not carrying a lot of heavy detoxifying burdens or toxins in our body, so like mercury or herbicides or pesticides. So you would think that if we were basing our whole process on these 4 things, that they might be beneficial. This is a test that was done by a large university, and they were looking at only 3 of these. They looked at hormone balancing, fitness, and nutrition. So they took seniors, so adults, and men and women, and they just changed these 3 factors, and they started noticing an improvement in most of the things that we consider aging. So energy improved 83%, memory 59%, productivity 65%, strength 73%, body fat 68%, lean body muscle, libido, sexual performance, facial appearance, skin tone, athletic performance, pain relief, better sleep, sense of well-being, and frequency of illness. All these things improved in the range of about 80%. So that's what the synergy of getting your fitness and your hormones and your nutrition all in order. So one of the questions that we ask if we have a group is, which do you think is better, traditional or natural medicine? We practice here what we call integrative medicine, which is actually the combination of traditional and natural medicine. We're not just natural medical doctors. We do advocate. I've been a surgeon for a long time. I've been an OBGYN, a traditional medical doctor, so we have that component as well as the natural medicine. We're going to look at men and women. Men and women go through hormone changes differently. Maybe you notice that men and women are a little bit different, okay, and a lot of difference there. Men will go through the changes. This is hormone levels on this axis right here. This is age. You can see that as men age, their hormones go up. So when they start off children and go through puberty, their hormones hit real high back in their 20s and 30s. But then they start a slippery slope down. Men don't usually feel that. We start down, we're only down, I think, about 1% a year on our hormones. But by the time you get out 30 and 40 years, you're way down here, okay? But guys don't usually feel it. We don't notice that. I was kind of like that. I didn't notice that I had changed, but I was changing. Women usually notice it. So women, this is their hormone levels. This is their age. They'll go up usually and reach into puberty. They'll start here and get into their 30s and 40s. Their hormones are usually pretty even back at the time at which they're usually having children in the reproductive ages. But then all of a sudden you get into perimenopause and it starts wibble wobbling. So girls' hormones will start wobbling. This is very disconcerting. This is when you have a lot of mood changes, sleep problems, such like that, headaches. And then all of a sudden they fall. It almost is a cataclysmic fall. And when it falls, you start having problems with degeneration of your organ systems, vaginal dryness, skin changes, hot flashes, things such as that. So women usually will feel that very much. Men, as I said, don't feel it. They even call men going into the gray zone because they don't feel it. Women do. This is the 7 dwarfs of menopause. This is I just had a woman I was showing this to about 2 days ago, and she said she has every one of those, I think, except one of them. Okay, she came in, was having problems. So this was coined by Suzanne Summers, okay, and she's coined these: itchy, bitchy, sweaty, sleepy, bloaty, forgetful, and psycho. And sometimes, women will laugh because they've noticed that they've had this. So here's 2 men, and one man. Which guy do you think might be balancing hormones, or which guy might you think be staying in physical fitness or eating well? So, and it's especially would be more likely to notice the difference. This man is 48 years old, and this guy is 64 over here. So the difference between these guys is very obvious. We talk about anabolism and catabolism in hormones. So one of the things that you want to do in anti-aging method is to help you stay in anabolism. Anabolism means building up your body, building up the muscles, building up the brain, building up all the neurohormones in your body. Catabolism means that your body starts degenerating or it goes downhill. This is what you don't want. Okay, so you want to constantly try to fight that catabolism of aging with anabolism. Hormone balancing is one of the major ways that you can make anabolism of our bodies. This is the way we age. These are biomarkers of aging. This is age again. Biomarkers of aging, there's lots of biomarkers of aging. So some of them are how we feel. I look good, I feel good, I have a lot of pep and energy to my step, my sexuality is good, my brain's working good. These are things that you might feel. Objective findings might be like what I had, like cholesterol findings, or my blood pressure's going up, or your weight's going up. But there's thousands of these biomarkers. Think of these as health markers or aging markers, okay? And they usually get better, so our markers usually go up at this point, but then they reach this point at which we call it going over the hill. We go over the hill. It happens earlier than what we would think. For males, it's about somewhere near 18. For females, it's around in our 20s and 30s. So, but we start this slope downwards, okay? This is where you don't want to be. You see this red line, okay? This is very poor quality of life. You're going to end up dying much earlier. Look at this line of this dotted line right here. This dotted line, you want to keep that line, that's a line of poor health. You want to keep that as short as possible as we get older. So you don't want to be having a lot of less quality of life. This would be where you start getting arthritis or heart disease, start going on medications. Maybe you have depression or anxiety. This is where you don't want to be. These people, There's probably not here watching Facebook right now. I can tell you why. People on this line usually don't watch health lectures. Okay, they're usually at home watching, I don't know, reruns of the Simpsons or something like that, and eating Cheetos and drinking beer or something. Most of us are on this line right here, this yellow line. Notice that we'll start usually having less quality of life somewhere around in our 60s or 70s. We'll start having some problems that we notice. Most of us, I think, average death rate now in the United States is somewhere near 82. Now, this is where you want to be. This is where you are going to try to go. This is a good line. This slope, you want to live as long as you can, but shorten that length of time at which you have poor health. And there have been people that have done that quite well. One of the questions that sometimes asked to me is, can you take somebody on this line? In fact, I had this asked just the other day, because this lady felt like she was on the average line. Can you take it and put it up to the good line? And the answer is absolutely yes, that you can. That's what we're going to talk about tonight. How can we take someone on the average line, which most of us are on, or some may be up higher, and put us on a better quality of life or better line? This is a timeline of disease. This is wellness, good energy, good vitality. We start along going here, and all of a sudden, people have disease. But it didn't happen just overnight, did it? You don't go from being well to being sick. Usually you're going to go through a timeline. You start having early symptoms. Sometimes you feel sick, but your lab tests are normal. You go to see your doctor, and he says, well, your lab tests look fine. But the problem is with traditional lab tests is that we usually have pretty far along, at least 80% along the way at the time at which we start noticing that we're now a member of the club. In other words, oh yeah, you have heart disease now, or you have cancer, or you have Alzheimer's, or something like that. In integrative medicine, we try to take this area right here, and we try to look at what could it be that we could change that might get to where the disease process does not find us. So we look at toxins in our system. They have toxins that could be causing cancer. How about nutritional deficiencies? How about hormones, genetics? We run tests over in this area to prevent conditions of aging. So we now have, in integrative medicine, a lot of our tests will pick up things much earlier, and we can prevent us from having problems. This is what it would look like in pictorials. As you can see, these people are usually getting better. Usually people think they go over the hill around 40. Why is that? Because they don't feel it as a rule. So this guy has plenty of vitality, but then all of a sudden we start going over this slippery slope. And it becomes, in pictures, we can see the difference between somebody that's aging gracefully and living a longer life. This is Tina Turner. She's 75, doing a show on television, doing, I think, the Proud Mary thing, okay, that she did when she was younger in her 20s and 30s. This is a woman that's 73. She's somewhat disabled and requiring a lot of medication. We see it even more. This is Lillian Vernon. Lillian Vernon, she's 85 here in this picture. Lillian Vernon passed at 90, but she was running a Fortune 500 company at 85. Here's a man 84 who's totally disabled. The thing is, a lot of people say, well, this just happened to them, or it was fate or something. But good health is, for the most part, a choice. Things that you can do right now to help yourself continue on this line. Who's this? This is Jack LaLanne, if you can see him. Jack LaLanne passed also, but he's 95 here doing this show. He's doing a show on television where he's doing showing a fitness show. So he's pretty good. He died at 1 year after this. He had, if you ask me, one of the shortest lengths of time of poor health. I think somebody said it's like 3 days. He got pneumonia and passed. But I'd say he's a real mark, what we want to try for. So hormones, let's talk about them. They're messengers that enter the body from your bloodstream. They come from glands in your body. There are thousands of hormones. People say, well, there's only two, estrogen and testosterone, right? Those are two hormones, male hormone and a female hormone. And they enter your body they come from your brain. There's 200 brain hormones. There's pituitary hormones. There's thyroid hormones. There's adrenal hormones. There's hormones in your fat. Yes, there's gonadal hormones as well. They work as a lock and key principle. This lock and key, as you can see, the hormone has to exactly fit the receptor site on the cell. So that hormone has to be an exact hormone to be able to fit into that receptor. One of the problems that we found in the past is that when we tried synthetic hormones, what we were doing, we were making a hormone that we were trying to turn on that receptor, but it just wasn't able to do it, or wasn't able to do it exactly right, and was causing a lot of problems. So hormones turn on switches that help regulate our overall health and well-being. Hormone imbalances affect our mental capabilities, our sexual health, our physical strength, our body composition. We used to think that as we aged, our hormones dropped. We now think, and listen, this is very important, we now think that as our hormones drop, we start symptoms of aging. Do you understand? Did you get that difference between that? And that's very hopeful, because we can balance our hormone levels and we can keep our symptoms of aging from happening. So you have symptoms of aging because your hormones decline. And we're going to talk about balancing them tonight. So we're going to get them back in balance. This says your hormones are out of balance. We need to get more of them over to the other side. We're going to do that. So let's look at thyroid. Thyroid's kind of a, that's been around for over 100 years. Thyroid speeds up metabolism. It stimulates energy. It controls weight. When it's deficient, you feel cold. You feel fatigued. You're depressed. Dry, thin skin. Cold hands. Weight increasing around the middle. Stiff joints. You feel better after exercise. That's an odd symptom of a disease. You feel better after exercise, but usually I'll tell somebody that has low thyroid, I'll ask them, do they feel better or worse after they exercise? Almost always they'll tell me they feel better because their body warms up. So thyroid keeps your body cool, not operating at maximum metabolism. When it's balanced, it improves memory, concentration, warms the body, stimulates fat burning, dissolves cholesterol, opens up the arteries, improves blood flow, reduces risks of heart disease and cancer. That's what I call anti-aging right there. So just with that hormone right there, with thyroid, now thyroid is active as T3. So I see a lot of problems sometimes with synthetic thyroid when patients come to me and their T3 is really low. They feel like they're having hypothyroid, but their thyroid numbers look good. If you ran the numbers in their labs, they'd find out that they're good. If we run these labs as T3, we find out that it's running low. So we're able to balance that hormone. Progesterone is primarily a female hormone. It's also found in males. We use progesterone a lot to help males, especially with their prostate glands. So males that have enlargement of the prostate or problems urinating do really well with progesterone. When it's deficient, when progesterone is deficient, and by the way, that happens a lot in that wibble-wobble stage of women that when we talked about the perimenopause, you get PMS and depression, you get heavy bleeding, bloating, weight gain, fluid retention, irritability, insomnia, endometriosis, fibroids, adenomyosis, and cancer from that. I see this group of conditions almost every day for new patients coming in to me. When it's balanced, it improves mood, regular menses, it maintains blood sugar, burns fat. It's a natural diuretic. It's a calming agent. It's a GABAergic. GABA is the calming neurotransmitter of our body. Gives us restful sleep for the same reason. It preserves normal breast and uterus, prevents cancer. A lot of times what we found was that the progestins, which are synthetic hormones, a lot of people come to me and say, I'm afraid of hormones because they might cause cancer. And what we found is that these progestins and progestogens, which are not actual true natural progesterones, are carcinogenic. In fact, they increase your cancer risk of the breast somewhere in the ranges of 60%. So we don't advocate those. Estrogen is a female hormone. This is what most people think of as hormones for girls. It's produced in the ovaries. It can be produced in fat cells and adrenal cells, and even produced in males in their fat cells. So we see a lot of men coming in with high estrogen levels as well. It's a deficient. It has depression, hot flashes, hair loss, hair growth. Sometimes hair growth where you don't want it, and hair loss where you don't want to lose hair. You have fine wrinkles around the mouth and the lips, vaginal dryness, lack of sexual desire, menstrual problems. You lose your figure. When it's balanced, you maintain your feminine features, smooth, unwrinkled skin, positive mood, enthusiasm, desire for sex and love, protects bones and brains and heart, supports immunity. And again, what happens is with the synthetic hormones, we were trying to come in and turn on a receptor. We were using, instead of using the exact key or the exact bioidentical hormone, we were using a synthetic hormone to try to turn that lock on it. It wasn't working quite right. This is the difference between pharmaceutical hormones, chemical hormones, and bioidentical hormones. The pharmaceutical hormones are chemically different. As I told you, they're a mimic. They try to mimic the natural hormones. The natural hormones are biologically exact. They're an exact copy of what your ovaries and your testes were making when you were younger. The pharmaceutical hormones start off kind of unusual. Horsemare urine is one of the things we use. Go figure. I don't understand that one at all. Kerosene. The bioidentical hormones are synthesized from soys or yams. This is a one-size-fits-all, so we're trying to get a tablet or something that fits one size. We individually assess them through labs, and then we balance them through your lab test. These are not balanced. These you expect side effects. The side effects are rare. These increase inflammation. These decrease inflammation. These increase blood clots. So you'll see on some of the pharmaceutical warnings that these could increase blood clots. These do not increase blood clots. These increase cancer risk. These do not. Okay, these increase heart risk. These do not. In fact, they decrease heart risk in the range of 50%. So tests have been done on these hormones for years, and they've noticed that they decrease heart disease and Alzheimer's. Alzheimer's risks. Dr. Bredesen, that does work up at Buck Institute, advocates hormone balancing to help with Alzheimer's. These increase Alzheimer's and increase heart disease. Testosterone is usually considered a hormone of virility. It's important to both men and women, and exception of a couple of things, okay? But most of the things are the same. I'll point out a couple things, erections, okay, and prostates, because you girls don't have those parts, okay? But these are the only two that actually are different, that has the same thing for each of us. So sharpness of mind stimulates erections and ejaculation in males, stimulates libido in males and females. It reduces risks of heart disease and angina. It counters high cholesterol. It builds and tones muscles, reduces fat, stimulates hair growth, prevents joint muscle pain. When it's deficient, we have all these things: fatigue, the memory suffers. As I said, it's one of the biggest memory things we can get. So Dr. Bredesen, again, advocates testosterone for memory problems. Lose competitiveness, we get depression and grumpy. By the way, this depression and grumpy, that would be, remember I told you that my wife called me curmudgeon? I guess that's what that means right there. Flabby muscles, beer belly, I was getting that. Soft appearance of hips and breasts, I was actually getting that too. I looked at pictures of myself. We're going through some old pictures back in that era, and I was going like, oh my gosh, I was fat back then. Human growth hormone, it's one of our #1 anti-aging hormones. It helps us when we're younger to grow. As we get a little bit older, it runs down. When it does, we start having problems. Some of the things is saggy face, okay, thin skin, lose muscle. I rebalance my growth hormone. I've been doing so for probably over 10 years, and we've kept what it does. It keeps your body elastic, so it keeps your skin elastic and keeps that fibrinogen working in the skin. Extra weight, fatigue, anxiety, depression, low resistance to stress. You feel incompetent. Maintains when it's balanced. It maintains muscle tone, decreases fat, provides energy, restores sleep, lessens anxiety, feeling of serenity and security, endurance, especially endurance. Males and females that like to do endurance sports will notice a huge difference on replenishing their growth hormone. Strong bones and joints, and protects the heart. I've got 3 patients here. One of them has pictures. They said it's okay for me to show these pictures. So if we see somebody that you know, then they've okayed it, okay? And you probably can't see this. I know it's kind of dull. This is a profile of Jack. Jack came to me. His wife suggested he come. Very similar to my story. He was run down, wasn't the man he used to be very active. She asked me to see him. I saw Jack. I said, Jack, what are you here for? He said, I don't know. My wife asked me to come. And we get a lot of that. And she said that, so he says, I just thought I was aging. And he started going over. The doctor said he had high blood pressure, he had high cholesterol, he was on a lot of medications. He didn't like the way things were going. He said, well, let me run some hormone levels. Jack. I said I ran them on myself. Turned out very good for me. So we found out that his testosterone was terrible. It's 136 here. It's supposed to be somewhere around 800. His growth hormone was way down. We were able to balance Jack. This is 5 months later. He's lost, I think, somewhere in the range of 50 pounds in that length of time. Now, I think he is showing off a bit because I think he's holding his stomach in. He's actually taking a picture of himself in the mirror. So he was pretty proud of the way he was feeling. This is Jackie. Jackie was a 37, or is a 37-year-old divorced female dating 2 children, 8 and 10. She's a medical assistant. She doesn't use alcohol or drugs, eats well, exercises, takes multivitamins. You would think she would be doing good. She wasn't feeling good. She had complaints, headaches, breast tenderness, weight gain, bloating, swelling, ankles and feet, hands. She couldn't figure it out what was going on with her. Painful menstruation. Her emotional lability was even harder, rougher. She had anxiety, panic, depression, irritability, increased guilt, problems with self-image, low sex drive. Not good if you're dating, fatigue, okay? We ran hormone levels on Jackie, and she had a common problem that we see, probably in the perimenopausal area. She was getting a little bit early, is estrogen dominance. Her estrogen was actually too high for her progesterone. Her progesterone, we couldn't even read it. It was below 0.5. Her estrogen was 186. That should be somewhere more near 80 to 100. So we were able to help her out, get her back. Oh, by the way, her testosterone was 29. So we were able to give Jackie back some progesterone and testosterone. We were able to get her back into shape. She started losing weight. Almost all the emotional lability went away. Remember, we talked about that progesterone was a feel-good hormone. It's a chill-out hormone. She was sleeping better. This is Shelly R. This is a very common patient. Had one like this actually this morning. 55-year-old, 2 children, 1 grandchild. She had a hysterectomy. She craved carbs. She had 2 drinks of wine a night. She exercises 3 times a week, takes multivitamins, calcium. She tried Premarin, which is a synthetic hormone, and she did not do well. She had weight gain on that. So she did. She has weight gain. Her bone density was really, really low. It's minus 3.7. Cholesterol was elevated at 237. Her HDL, or good cholesterol, was down. Her blood pressure was up. She was feeling flabby. She had vaginal dryness, no sex drive. Emotionality was poor. She couldn't sleep. She was irritable in the morning and then tired at night. She has hot flashes, night sweats, mental focus. So she was more or less falling apart. Her labs were consistent with menopause. Her estrogens were down. Progesterone was unmeasurable. Her testosterone was very low. Her adrenal gland was down as well. We were able to treat her with hormone rebalancing, and she's right now to this day is feeling wonderful. And by the way, her bone density came back to normal. We didn't have to give any bisphosphonates, no synthetic things to help her bones regrow. But she's got back into exercise, feeling good, and eating well. Why would you invest in your health? Why would you come to a place like the Renewal Point? You invest in your car, you invest in your computer, your clothes, things that we have. You want to invest in the one thing that's going to be certain to be there with you all your life. What do you get for all this? What do you get for investing in your health? Increase energy, being able to stay in the game if you're athletic, increase performance and strength, protect your brain, get fit, energy, protect your heart, lose weight. All these are reasons why you might want to do hormone balancing, or, as I said, come here to the Renewal Point. This is our updated technological phone service right there. So you want to call our office to do a in-office home call. Jennifer got that going. Didn't you find that one? Or you can do a telemed. We're now, from the COVID people, a lot of people don't want to come into the office. We're available on to do telemedicine. Okay, and we have home hormone testing, and you can do it at your house if you want. So this is our seminar for tonight. I think, are we having questions, did you say? Okay.
We have 5
5 questions. Okay.
So Brenda wants to know, can someone have too much estrogen?
Okay. Yes, you can have. So we saw a patient that had too much estrogen, which we call estrogen dominance. Remember the one that had the too high of estrogen? So that's one case. Males can have too high of estrogen if they're taking testosterone, or even if they're not. One of the things we see, males come in and they'll say, well, my testosterone levels are normal, but I'm not feeling good. And they'll have high estrogens as well. So we're able to help them get down their estrogen levels. With girls, it's a little bit different. You have to kind of work with them, because the ovaries are putting out during the perimenopause just huge amounts of estrogen. But the question is, yes, you can. And sometimes we find that if you're taking bioidentical hormones, or even hormones, or even synthetic hormones, you can have too much estrogen.
Ben wants to know, can testosterone supplementation increase the risk of prostate cancer?
Wait just a minute. Oh, repeat the question. Okay, sorry.
So Ben wants to know, can testosterone supplementation increase the risk of prostate cancer?
Okay. Can a testosterone supplementation increase the risk of prostate cancer? Synthetic estrogen, or synthetic testosterone has been known to do that. Bioidentical testosterone has not. So they've run tests. Dr. Morgan Taylor, who's a Harvard urologist, has run tests for many years. Actually, he went back 40 years and looked into the research and found that the testosterone replacement did not increase the risk of prostate cancer. And that was thought, even when I was growing up, when I was a young Doc Watts, that was the theory, that taking testosterone increased prostate cancer. I think the thing was, we were using synthetic testosterone back then. If you get testosterone from a gym, or I think we have guys coming in and been working out and they don't even know what they're taking, yes, that can increase prostate cancer. If you're taking bioidentical hormones that's balanced and watched over by a physician, knows what they're doing, should not increase that. Dr. Morgan Taylor from the Harvard urologist found no increase in prostate cancer.
Connie wants to know, can hormone therapy help memory?
So Connie wants to know, can hormone therapy help memory? So remember, we talked about a Dr. Bredesen, who is he's a neurologist at Buck Institute. He's been doing work for about 10 years now, and he has several modalities that he changes to help brain health. One of them is hormone balancing. He's found that hormone balancing increases your brain health, or increases cognition, in the range of about 50%. As far as just pure estrogen increases it in the range of about 30%. So the 50% is all the hormones. Estrogen is in the range of about 30% increase in brain problems, or let's say 30% decrease in cognitive decline.
Judith actually has two questions. The first is it true eating soy increases estrogen in women?
Now what?
Is it true eating soy increases estrogen in women?
Okay, so somebody has questions. Julian? Judy has a question. Does increasing soy increase, eating soy increase estrogen in women? So yes, soy is a phytoestrogen. It is a weak plant estrogen, and it does increase estrogens in women. We actually use soy a little bit in the perimenopause if we're trying to boost a woman that's just needs a little bit of help. We don't usually worry about soy too much. We like the fermented types. If you eat too much soy, there is a controversy that it could increase estrogen to the point that it's detrimental to you, though. And there was two questions, you said?
She had another. Judith also wanted to know, for her husband, do you run heavy metal testing, because his labs are always perfect? What's not been run? So it's a two-part question.
So do we run heavy metal testing? Yes, we do.
Okay.
We do run heavy metal testing.
What's missing on the labs that they normally run for him to detect heavy metals?
Okay, so heavy metals they're hard to detect in your blood. They don't exist in your blood as a rule. They usually exist in the soft tissues of your body, in your brain, in your bones, in your muscles, in your heart tissue. So I could sit here and drink some lead or mercury in front of you right here, and that would be in my bloodstream maybe for 3 months. By that time, it'd be gone, and you could assume, well, it's gone. But it hasn't. It's assimilated into my body. So mercury, lead, things like this become part of our body. So you have to do what we call a provoked urine. We have to give a chelating agent to the person. Goes through the body, goes into the brain, into the heart, into the soft tissues. It's totally non-metabolic. It does not stay in the body. It comes running out. but with it, it grabs hold of any heavy metal, and we can check that to see if there's heavy metal in the body. So usually in any blood lab, for instance, you're not going to be able to get a good estimate of your heavy metals.
Okay. And last question, Marilyn would like to know if hormones increase weight.
Okay. So hormones increase weight. So hormone balancing or just hormones, okay? Hormones, okay. So hormones, yes. If you have hormone imbalances, they are one of the main things that can increase weight. So hormone imbalances, especially adrenal gland, the thyroid, the estrogen, progesterone, all these, if they're out of balance, will increase weight. What we try to do is to get someone to, of course, working out, eating correctly, and then balancing the hormones. That balancing the hormones is one of the major things that helps us lose weight. Or maybe you remember when you were in your 20s or earlier, when your hormones were, very stable and everything. It was easier to lose weight. You could do a lot of things back then. As you get older, you can't. A lot of that is because of the hormone balancing. Good questions, everybody, by the way. Anything else here from you guys? Okay. So we're going to call it a night. Okay. Thank you for joining us. Thanks for all the questions that you sent us, and we appreciate you being here with us. Good night.